Welcome everybody. This is Dr. Sally Diab, dermatologist, registrar from Riyadh, KSA. This is a part of training you asked for to be a trainer for Aptos here. I used Aptos for years before, so this is a full case for demonstration. This patient is a middle-aged woman. She has no filler on the face before. She has a light skin, sagging skin. She just had threads BDO about 4 to 5 years ago. She wants to eliminate the nasolabial fold, to elevate the jowl and the submental area. Also, she wants to augment the cheeks. She wants elevation with augmentation. So for this case, I decided to use visage method for submental area. For jawline definition and the lower face, I will use thread to G. The type I have here is cutting needle. I don't have blunt needle. I prefer blunt needle, but it is not available for now here. For augmentation and the elevation of the cheeks area, I will use Excellence Visage method. She wants also to elevate her nose tips because it is long and bending down. So we may use the Rhinoplasty method for nose definition. Now we will mark here. We will start with the submental area. We will introduce and inject the threads behind this ligament here. So we will start here. Till the middle line. And cross it a little bit. In this area also, we will introduce the other visage thread, 19. For this area, I will use thread 2G, thread method. We will start in front of the tragus. Here, and 2 centimeters above it, we will introduce, and this is the exit. For visage method, Excellence Visage method, we will start on the goma. First one, we will introduce here. Second, and third, we will bend it so we can augment the cheeks to correct the nasolabial fold. For the nose, I will put to support the rhinoplasty support here and elevate here. We will start in the tip of the nose, support here, and elevate the nasal tip. The other side. We will go here, the first one, second one will be here. This is the marking. Stop. Now we start the sterilization. Yes, let me wear it. Okay, let's anesthesia. I will not use too much anesthesia, so the edema will be less. No camera. Needle, please. Needle again, please. Anesthesia, more anesthesia. More anesthesia. ممكن وشك الناحية دي. Needle again. Needle again, please. Now betadine, please. More betadine. You have camera for nose rhinoplasty, right? The other camera, yes, put in anesthesia. Yes. More anesthesia. the needle and I will put a little anesthesia for nose also. I forgot it first. We'll start with visage for submental area and jawline definition. Needle. Hold this. First one, remove please. Retract the tissue over the thread. And we'll go back again. Second one. We'll cross the middle line, retract the tissue, and this is a tip I will introduce inside. I will not cut it. Okay, no, I need the thread to G. Okay, this is thread method, thread to G. This is sharp. This is what available now. I will start with the lower one, a little above. There is a little bit superficial, so. They will come out here. Cut, please, at the tip. The other one, I will anchor it. A little bit dimpling. I will come back a little. Yes, this is perfect. This is because I prefer the blunt. Cut, please. Okay. We'll start with visage here, needle and visage. The upper one. Retract the tissue right before the nasolabial fold. I will go back maybe 3 times. This will be good. Second one. Remove this hair. It's a hair. With, yes, with a goose. Cover the hair. Yes, please cover with this. Okay. The tip is obvious, so I will put it back, anchoring it in the tissue. The last one here, the third one. I will go a little bit deeper, not in the muscle, but a little bit deeper, and will twist like this. Like this. For thread method, I like to overcorrect a little bit, and I will cut after finishing the other side. We'll start with other side. Okay, another one. Open the other one. The thread tissue, please. Needle. It is sharp, I can go. It's a lower one. Cut, please. Cut at step. Yes. Space. Little bit anchoring for this. Wide space of that thread. Cut, please. You have to. No, I need the cannula again. Please, the cannula again. The one I used. Yes. I need third one. Third one, please. From there. This is for augmentation and elevation. We'll go a little bit deeper. Okay. We'll start with the nose. Nose, please. This. In the nose, I will start with the tip. The first thread, I will build the bridge. For this, I will go here and contract the tissue, and with the same entry, I will do the support. Yes, this still, I definitely will bend it inside the tissue, will not cut it. third one, we'll do support here. And also fix it like this. I also will do over stretching here, so it will be perfect after swelling when swelling gone. Force. Her nostril is small. If it is wide, I can support the sides with the threads. I did it before, but for her, I will not do it today. This is the most important area because she has a long tip, so I want to support it very well. Later, I may do Botox also. Okay, we'll start cutting, but after we stretch here. The other side. And we will start revealing the result. There is a little bit of edema. I didn't use a lot of anesthesia, but we will clean and we will show you. Clean, Christine, please. Now we finished our case. The nasolabial is decreased a lot. I'm really impressed. The marionette lines also elevated. The jawline now is more defined. The jawline now is more defined. She has a small jawline, small jaw, so she can add more fillers or anything later. In my clinic, I may add a little bit of filler during the procedure, but not now. Now it is more defined. The cheek is augmented. Now you can see the augmentation and elevation from the other side, please. Here also, the cheekbones and the cheek is now defined, and the jawline is more defined. The swelling will go, and there is a little bit of depression here. I can release. Yes, it is good. The nose tip is elevated. The bridge is more defined. This is good for her. I will show her the mirror. Can you give her a mirror? See, please. What do you think? Okay. Okay, I'm supposed to talk with her in Arabic. I will tell her later, but this is for you now. You have a little bit of swelling due to anesthesia and the procedure. It will go. I will prescribe to you some medicine, antibiotic, and maybe painkiller. This will not be so much painful, but just to relieve you. We will give you some instructions to follow. So can you keep the threads perfect? My patient, I used to do threads Aptos for them. They return after a year or a year and a half to do it again. You understand me? You understand English? Yes. Perfect. You are perfect. Okay, I will tell you in Arabic later. Okay. Anything? Any question? أي سؤال?
Thank you.
Okay. Your nose. She's very pleased of her nose because the muscle is strong, so the muscle pulls down the threads also. The nose tip also. We elevate it, and after this, I will inject some little bit of Botox to what? So she noted the nostrils and the opening of her nose become smaller. They before was wide. It is narrow now. Okay, now your jaw is defined. You may notice a little bit variation of this side from side. We can manage it after the threads settle down. We can add some fillers or may add some touch up of threads if you want, or nothing if it is okay with you. We used 3 visage method, excellent visage method. Here, 3 here, 2 and 2 in the submental area. It is now good. And here we used a thread method, the cutting needle. I love the blunt, but that is the way. Okay, we can take pictures for you, photos for you. Even the depression under the eye, it is now a little. It is now a little bit smaller. We can add filler later. Yes, come please.